Again, I'm Kerry Rood. I'm an extension veterinarian at Utah State University. So we're going to talk a little bit about herd health, vaccinations as it relates to beef cattle, and how do we minimize risk, or how do we reduce the risk on our operations. And if we, let's see, somebody's saying they only see so many people, nobody else. That's because everybody else has turned off their video, and so they're not seeing, you're not seeing anybody else because nobody else has turned on their video. And this person says they can't see my slides. Can everybody see my slides? I've shared the slides here.
I can see them.
I can see them.
Perfect. So you can see slides. Wonderful. All right. So feel free to chat in, and I'll try to respond to those as we go. But when we're reducing the risk from disease, we focus on things that that we can use from a management standpoint that minimize this risk. One of those is vaccinations. But we're going to talk a little bit about vaccination and immunology, but we can't lose focus that vaccines can't cover up husbandry issues like parasitism or poor nutrition or poor animal welfare, husbandry, or poor genetics. And I think sometimes we have a problem, let's say it's scours, or we have pneumonia, and we want to reach for a vaccine to prevent it, when in fact maybe there's some management strategies that we can talk about that even if we were to give the vaccine or the antibiotic or whatever, because we have these underlying management issues, the problem still may be there and not resolve itself. This is a diagram that many of you have seen before. It talks about the 3 factors that go into causing disease or influencing disease, and that is the host factors, which in this case is the cow. We have the pathogen factors, and I sort of think about this as the bug, the virus, the bacteria, etc., and the environment. Those all play a role in the disease in the animal. So some of the factors on the cow side are immunology and the stage of lactation, their age, what nutritional plane they're on. On the bug side, it's whether the ability of the organism to invade the host and cause disease. Those are all factors. And then in the environment, things like housing and stocking density and climate, those types of things are what we talk about when we look at environment. So when we talk about vaccine strategy, there are some questions that we have to ask ourselves. What type of animals and age are involved? What diseases are most common in the area or your area or the producer's area? What are you trying to prevent? And then is there good management to couple with the vaccine that can help it be more effective? And I always put a plug in with consult your veterinarian, because that's really important. And I think that one thing I tell the producers is call your veterinarian up, book an appointment at the local hamburger joint or cafe, book out a 30-minute appointment or an hour appointment, meet there, buy them lunch or buy them dinner, spend an hour, maybe it'll cost you $100, and then go over what you think the best protocol in your area should be with your veterinarian. And I think that'd be a good $50 to $100 well spent. And if you have any size of an operation, that can be less than $2 a head to consult with your veterinarian. And I think it'd be money well spent. That picture there is a dairy that we were on here a few years ago. And even though this animal is maybe well protected for disease, it's drinking out of this muddy water, and it's in an environment that's not very conducive to being disease-free. And so you can sort of think about that. That picture reminds me of a scenario. You could put all the vaccines and the antibiotics you wanted into this cow, but she's really exposing herself to a lot of disease by drinking out of that water. She was actually drinking out of that pond there, and so her environment then really is not conducive to decreasing the risk for disease. Let's talk about immunity here and remind ourselves about immunity just a little bit. Here is a diagram. It's a diagram I borrowed from Dr. Stott, and I think Dr. Stott borrowed it from an immunology textbook. And this diagram has 3 colored lines on it. It has a green and, to me, a yellow and then a red. And the red line represents the immune threshold, or an arbitrary line that says if at any time either the yellow or the green lines are below the red, the calf is at risk for disease. The yellow line represents the maternal antibodies that the calf receives when it nurses colostrum, that first milk from its mother. And then the green line represents its own active immunity, the calf's own immunity, as it builds up over time. Along the x-axis is a time. It doesn't, it's in months in this case here, but the principle is that when the calf is first born, it's fairly immune naive. In other words, its immune system it's not geared up to address pathogens that might be in the environment. But Mother Nature's provided a way from that mother's first milk that when it nurses that colostrum, it absorbs immunoglobulins, and that represents the yellow line. So just shortly after birth, the yellow line spikes within the first 24 hours of life. These immunoglobulins are absorbed, and then it goes down over time. The green line represents its own active immunity, and it takes a while for that to get geared up. So it takes the spleen and the thymus and all of these lymph nodes and all the white blood cells and everything to get geared up. So that takes a period of time for that to increase. There are a couple of things management-wise we can do to influence these lines. So in theory, we want to reduce the rate at which that yellow line decreases over time. And there's a couple of ways that we can do that. First of all, we can make sure it gets adequate colostrum. So that line then actually gets as high, and I don't know if you can see my cursor, it can get as high as it possibly can. And that's by making sure that the mother has good, adequate, high-quality colostrum that the offspring is able to ingest. Then we can house the calf, in this case, in an environment that it's not exposed to a lot of pathogens, because the more pathogens that it's exposed to, the quicker that yellow line will decrease over time. The green line, we can do some things to manage the calf's active immunity. And those are through the course of vaccination. So we can start giving some vaccines to increase the pitch of that green line. So this next slide, if I'll go to the next slide, you can see that green line increases in pitch. So it goes up a lot steeper, if you will, in a more steep pitch. And that's because they provided some vaccination at about 2 or 3 months of age. And so we'll go back one slide. You can see that the green line, this represents not being vaccinated, and that green line increases over time. But then if I provide a vaccine at about 2 months of age or 3 months of age, you can see that green line then increases. So these are a couple of good things to understand, that we can do some things, some active things to stimulate and make sure the calf has the best immunity that's possible. The other point I want to hit on is we might hear these terms modified live, and sometimes we hear it as attenuated or killed vaccine that are out there. And there's some quite honestly, there's a lot of discussion in the popular press on modified live versus killed vaccines. So in general, modified live, the agent, and most of the time it's a virus, has gone through a number of passages in the lab, gone through some laboratory procedures that decreases its ability to cause disease when given. It's still alive, so it still replicates, but it might replicate at either a decreased rate, it might replicate only if certain conditions are met, or it might replicate temporarily and then go and then not survive. So that ability for this organism on the modified live side to replicate actually has some advantages. And the advantages are that it stimulates what we call, or the dogma out there refers to as, a more complete immune response. So it involves both the cellular side as well as the humoral side, or the antibody side. And so they claim that as these live organisms replicate, that it has a more complete immune response. The duration of immunity is longer because of this. It's sort of replicating, and there's more stages of the organism's life that the animal has, its immune system has exposure to. And so there may be a number of ways that it develops immunity. Killed, on the other hand, are where we take parts of the virus, and we, in essence, we take it in a blender and we blend it up, and we pull out cell wall fractions or fractions of protein, and there are protein immune sites called epitopes, and we bring these antigens, these proteins that will respond to the immune system, and we mix them together. They're killed. The virus, in this case, can't replicate, and we present it to the animal. So killed sometimes are less expensive because they're not replicating, and there's not as great a chance or any chance of them causing the disease that we're trying to prevent. So if we're trying to prevent abortion, then if we give a killed product, then it's not likely that the vaccine will cause abortion. So on the killed side, sometimes companies can respond a little bit quicker and provide vaccine updates, if you will, or provide the new strains more quickly. So this is sort of the theory behind modified live versus killed. Well, let's bring it down to a practical sense. What are some of the disadvantages? Well, on the modified live, because it's a live organism, in essence, it requires mixing or reconstitution of the vaccine. And the minute you do that, this time starts to tick, if you will. And a stopwatch happens, and it just sort of count down to when this vaccine is no longer active. That can be a problem because that vaccine that's modified live, that's mixed up, should be kept chilled and should be used within a few hours. And so there's some storage and there's some use issues with modified live that are disadvantaged when we compare to the killed products. It's also not recommended for all stages of gestation because it can potentially cause abortion depending on what fraction of organisms that you vaccinate for. But if you use some of the herpes fraction or the bovine viral diarrhea fractions, those two viruses have been implicated in abortions if you give a modified live product. The killed has some disadvantages as well, in that you have to booster the vaccine a little bit more frequently, and they have some specific regimens that you have to follow. Because that virus doesn't replicate, then it's not exposed to the animal. So you have to provide that enhanced exposure through boosters, through repeat vaccination. So that's a disadvantage on the killed side. And they require adjuvants. And adjuvants are fancy additives that they add to the vaccine that sort of provides a way for the immune system to be exposed to the antigens that are in the vaccine. Now, the adjuvants sometimes can cause problems themselves. And so back in the day, we used to add mercury as part of a vaccine for adjuvants. And if on the human side, you remember that that's come under a lot of fire for vaccine and autism and things on the human side. Well, adjuvants also can cause reactions on the animal side as well, and on the small animal side and the feline with our cats, there's a vaccine-induced sarcoma that can take place, a cancer, and so that's an issue that the adjuvants have. So those are some disadvantages with the modified live versus the killed. So let's look at an example of a vaccine here. So, and in no way am I endorsing any of these. I'm just using these as educational purposes. So we have, in fact, I don't even know if this vaccine's still out there. I went out and just grabbed it from the internet, and this has been a number of years ago. But we see there's a number of viruses there. So you can tell right away if it's a modified live or a killed product, because as you read down through the viruses, that's bovine rhinotracheitis, viral diarrhea, which is bovine viral diarrhea, parainfluenza 3, respiratory syncytial virus vaccine. It says right after that, it says killed virus. Now, the next organism is actually a bacteria, Haemophilus somnus. Actually, this is an old vaccine because that name has gone through a recent change. If Jane is on the call still, Jane, didn't they rename this Haemophilus somnus? They call it well, anyway.
Yeah, it's, they called it Histophilus somni.
There you go.
Histophilus. Twice.
Yeah. So that's been some time, maybe 5 years ago they changed the name, or?
Yeah. Quite a while.
Yeah. So anyway, it's a bacteria, and so that fraction is called a bacterin. But you'll see that this then is a killed product. And so let's go to the next example that I have here. So these are modified live products. I've got two of them here for you. I've got Pyramid 10, and then I've got Bovishield Gold. And just as examples, you can read down through on the label. It says right over here next to the viruses, it says modified live. And then it has some bacteria here that says it's a bacterin. And then if we get over here to the Bovishield Gold, you can see that it is modified live. The next point I wanted to reinforce is if you look at the label, it says, do not use in pregnant cows. Abortion can result unless they are unless they were vaccinated according to label directions with any Bovishield Gold FP or PregGuard Gold FP vaccine pre-breeding initially and within 12 months thereafter. So what that says is it's to remind you that the modified live fractions can replicate. And this rhino, as well as the BVD fraction, can cause abortions in the cows. So you can't vaccinate it in herds that have never seen modified live vaccines before. And Zoetis, which used to be Pfizer, wants to put on the claim that you have to use their product. So you can read on theirs that it's a specific label requirement that includes their product. Pyramid, the one on the left from Boehringer Ingelheim, has a very similar statement on their label about modified live vaccines and the precaution. Now, this is an interesting one. This contains a fraction that has some modified live virus, and then it also has some killed viruses in it. So this is one where they said, you know what we'll do? We're really worried about those that the modified live causing abortion, so we'll take the one or two viruses out that cause abortion, and we'll create a killed fraction there, and the other ones can be modified live. So you'll see some combinations on the market that include both modified live and killed product. So if you look really closely at this, this is Cattle Master. The killed virus here is BVD, bovine viral diarrhea. It's the killed fraction, and the modified live are the other three. So this is interesting You'll see that in the market where they will talk about a combination of modified live and killed being together. So that's kind of interesting. All right, let's talk about some vaccine recommendations, and we'll just sort of put out a chart like similar to this, and then we'll open it up for some questions here in our first stock and flock talk. Say that fast 4 times. So Jane, I don't know if you wanted to let everybody see you, but if you want to mute your camera, you're welcome to. Not a lot of people have their video cameras on. She's trying to figure out how to do it. Anyway, if you look at that table, I recommend, and I have this table, I can get it out to you if your producers would be interested, or the producers can contact me. It just sort of lists the livestock type on the left, so calves, heifers, cows, bulls, stockers. You could add other categories in there if you want to, if they're doing some steers, if they're doing some show calves, 4-H animals. We can have different livestock types here on the left. And then along the top, I sort of put some different stages in the management system and time points or areas that you might consider when to vaccinate. So on the bottom, I just put a few vaccines there so that we can sort of stimulate a conversation. So we have a 5-way, which is really the upper respiratory. And the reason why there's only 4 viruses mentioned is because BVD has 2 types there. So that's actually 5 viral fractions. And so if we click down, where would you want to give this? Well, for the calves, I think we'd want to do it branding. And here, branding, they're generally about 2 or 3 months of age. And that's really a common time that our producers can get their hands on the cows and the calves together. So we usually do that at branding. So Clostridial 8-way, that protects against some of the clostridial diseases that are out there, like blackleg and red water, and there's some others. And I usually give that pre-weaning. You can also do that at branding time as well, and many times that's when they're given because we don't have access to them. Oh, excuse me. I said you can booster the 5-way at pre-weaning. Let's go to the clostridial ones. So clostridial, I usually mirror the upper respiratory for those as well. Now, scour prevention is for the cows, and we want to give that pre-calving. So these are just sort of, when would you sort of pencil in some of these vaccines in the management process and when they should be given? So this is a conversation that you should have. Why do we avoid weaning time? Well, we avoid weaning time because weaning is a really tough time stress-wise for the calf and actually for the cow as well. And so as usually there's a process that involves pulling them off a public allotment. They're usually trucked back to a central feeding location. Sometimes that can be miles. They can be trailed for miles. I think down at Kevin Heaton talks about his family. That's actually not weaning time, but they actually trail their animals a long ways. Actually, that is at weaning time, if I remember right. They bring them down to the desert strip, and that can be a stressful time as you walk the animals. Regrettably, and this is what the textbook tells us, is to avoid that weaning time. But I got to be honest with you, in some production systems, that's the only time you can get your hands on the cows. And so I guess even though it might not make scientific or be the best scientifically, it's the only time we get our hands on them, and so we'll often give some vaccines at that time. So these are just some suggestions, and each of the management systems that are out there might look a little bit different. They'll probably have some of the similar vaccines, but they'll look a little bit different.